Hello, and welcome to Diabetes 101. My name is Dr. Brandy Irwin, and I'm a pediatrician on the committee to organize Diabetes Camp at ADA Camp Sealth. In this video today, we'll be discussing the basics of diabetes, including the difference between type 1 and type 2 diabetes, high and low blood glucose levels, and how we manage diabetes at camp. First, we're going to talk about the American Diabetes Association mission, though, which is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. One of the ways that we do this is by helping the kids with their diabetes at Camp Sealth, and we would not be able to do that without all the help of our wonderful volunteers. So thank you very much for taking the time to take part in the training that comes along with volunteering. We would not be able to do it without you. So we are going to move on to the basics of diabetes. We will first talk about type 1 diabetes. So type 1 is an autoimmune disease that affects the pancreas and destroys its ability to make insulin. The pancreas is an organ in your abdomen that produces the hormone insulin, which allows the body to convert carbohydrates or glucose from the food we eat into available energy for the body to use. It does this by acting like a key to open the cells of the body to allow glucose in. And as you can see from this diagram here on this slide, there's this tube here, which is representing a blood vessel and has these little stars in it, which are glucose molecules. And over here is a body cell, and obviously the key represents the insulin, and when the key attaches to the cell, it opens it up so that the glucose stars can get in. So in type 1 diabetes, the immune system mistakes the insulin creating cells in the pancreas for invaders and attacks and destroys them so that the body can't produce insulin. This means there's no way for the body's cells to get the energy they need to survive. So going back to this diagram again, if there's no key, if there's no insulin there, the cell's going to stay closed and no glucose will be available. So when that happens, the body feels like it's starving. Even if there's plenty of glucose in your blood vessels, it cannot be used without insulin to let it into the cells. For diabetics, since they don't have natural insulin available, they have to inject themselves with insulin every time they eat so that their body can use the energy from the food that they eat. We're going to go to a separate diagram just to give another explanation of how this works. So in this diagram, this yellow line here is showing your esophagus, and the little triangles, the green triangles, are food going down into the stomach. And then this little orange part here, this is representing the pancreas, and the blue dots are the insulin. So normally, when both the glucose and the insulin are in the bloodstream, which is represented by this orange line over here, although the glucose is red squares in this one, when it gets to the body's cells, the little blue insulin dots attach to the cell and open the doors for the glucose to go in. So in type 1 diabetes, the insulin is not available to attach to the cell. These little red doors stay closed, and the glucose stays in the bloodstream. So, as far as what causes type 1 diabetes, there are different triggers, both genetic and environmental, but oftentimes we don't really know why exactly type 1 diabetes happens. It seems to occur very randomly and can come on at any age, and there's lots of research going on to still figure out where diabetes comes from. Next is a question to you. Is diabetes contagious? This is probably a very easy question to answer for us, but for the campers that we're going to be working with at Camp Sealth, some of them might not know much about diabetes and might be curious as to whether or not they can get it. Of course, diabetes is not contagious, and definitely if anybody anybody asks that, you should reassure them that no, they are not going to get diabetes from someone else who has it. And unfortunately, as I'm sure you know, diabetes is not curable yet, but it is very treatable. Diabetics have to carry multiple supplies with them in order to treat themselves, and that's what we'll be doing at camp, is providing those supplies and care to make sure that the kids are getting everything they need. So now we are going to move on to type 2 diabetes, and we'll talk about that just a little bit. So type 2 is different from type 1 because your pancreas is still producing insulin. However, either the cells are not responding properly to the insulin, or the insulin that's produced naturally isn't enough to meet the needs of the body. So even though the insulin is still there, it's not working as well as it should. So going back to this diagram here, in type 2 diabetes, the little blue insulin dots are still there, but there may not be enough to attach to the cell to open all the glucose doors, or the cell might not be able to accept the insulin properly, so that there aren't as many doors available for the glucose to get in. So there might be some that gets in there, but there's still going to be a lot that's just hanging out in the bloodstream. So what are the risk factors with type 2 diabetes? This is a little different from type 1. It is definitely very genetic, but tends to run a lot more strongly in families than type 1 does. And there's also multiple lifestyle risk factors that can predispose people to getting type 2 diabetes. So those include a poor diet, lack of physical activity, and obesity. And when we talk about treatment in type 2 diabetes, some of the main treatments are modifying those risk factors to try to decrease the effects that it has on the body. There's also different medications that type 2 diabetics can use. That includes oral medications as well as sometimes insulin. We don't usually have type 2 diabetics at camp, so we're not going to talk more about that today. But if we do, then we will deal with that at camp. So now we're going to move on to the basics in type 1 diabetes management. So one of the most important things that we're going to be monitoring at camp is the blood glucose level. So in non-diabetics, your insulin is naturally being produced throughout the day and moving glucose into cells as it's necessary. But in diabetics, that's not the case, and the thing that we're going to be working very closely to keep track of is the blood glucose level. So for general purposes, the blood glucose level should be between 80 and 150, but for our campers at Camp Sealth, we have a little bit of a wider range, and we'll try to keep their blood glucose between 70 and 200. So in monitoring the blood glucose levels, one of the most important pieces of equipment that we use is called a glucometer, and this measures how much glucose is in a drop of blood. Our campers are going to be checking their blood glucose levels frequently throughout the day, and this will be done by using these devices here. So the first is what we call a lancet. That's this little device here. The pink and the blue one have a little cap on them. The purple one, the cap has been removed, and in this little piece at the bottom here, there's a small little needle, and when it is pressed against the finger, the needle pokes the finger and creates this little drop of blood right here that you can see in this next picture. And then with the glucometer, so this device here is the glucometer, it has a strip in it that when it is touched to the blood, it absorbs the blood, and then the meter is able to read that, and the number of how much glucose is in the bloodstream will pop up on the screen. And then there's another way that we can monitor blood glucose levels, and that is by a device called a continuous glucose monitor. So that's this device here at the bottom. This has two different pieces to it. One is attached to the skin, and that is monitoring the the glucose that's in the tissue underneath the skin. It's not actually monitoring what's in the blood, it's just monitoring the subcutaneous tissue and then sending that information to this little device here. So some of our campers will have these and some will not. And if they do have these, if the blood sugar gets too high or too low, this device will have an alarm that goes off to let the camper know that. For our purposes at Camp Sealth, that is going to mean if the alarm goes off that the blood glucose level needs to be checked. So if the continuous glucose monitor alarms, we check the blood glucose level from the fingertip and then use the blood glucose level to make any treatment decisions for whatever that level is. We're not going to rely on the numbers that pop up on the CGM screen. Then the next thing that we're going to talk about is how diet affects diabetes management. Diabetics have to keep track of how many carbohydrates they eat at every meal and snack. And we do that by counting the number of grams of carbohydrates that is in the food that's being consumed. So at camp, there's so the question that pops up next is, are there any forbidden foods at Camp Sealth? And there definitely are not. The campers are allowed to eat all of the regular summer camp food, and our dietitians will be working really hard to make sure that we know how many grams of carbs are in that food, because that will affect the amount of insulin that they need, and is very important for all of us to be aware of. And then moving on to exercise, this also must be taken into account because our campers are very active at camp. So does exercise affect blood glucose levels? Yes, it definitely does. We have, with all the activity that goes on at camp, the muscles in the body that are doing that activity can actually use up some of the glucose that's in the bloodstream. And so that affects the amount of insulin and the amount of carbohydrates that are needed to manage those blood glucose levels. Then, of course, insulin itself is very important in managing diabetes. So the insulin that we use is made synthetically and given by injecting it under the skin. There are multiple ways to give insulin. One is with a syringe and using a insulin in a vial. So there's a picture of that here, of using the syringe to pull the insulin out of the vial, and then that would be injected right under the skin. There's also a device called an insulin pen, which is up here at the top of the screen, and that has a little cartridge in it at the front that holds the insulin. There's a needle on the tip for injecting, and then there's this dial back here, so you dial in the amount of insulin that you need, and then just push this little plunger in to actually inject the insulin through the needle. And then there's also an insulin pump, which is this lower picture here, and we'll talk about that in a few minutes. So campers, though, who are using injections or insulin pen are going to be taking two different kinds of insulin. One lasts all day and is constantly working to move small amounts of glucose into the cells. This is called the basal dose of insulin. There's also short-acting insulin, or the bolus dose, which is given before eating to take care of the large amount of carbohydrates that are ingested at that time. The bolus insulin is also given if the blood glucose level gets too high to bring it back down into the normal range. So the injection and the pen use both of those different types of insulin. In the pump, which is this electronic device here, which is constantly attached to the skin through a little catheter system, and there's a tube that carries the insulin from this this little vial here into the skin, and then the amounts of insulin that are needed are managed through this screen and these little buttons here. And so the pump only uses short-acting insulin, and it's infused into the body slowly throughout the day, similar to how the pancreas would naturally function. And then at meal and snack time, the amount of carbohydrates that are being eaten are programmed into the pump, and then it's figured out how much insulin is needed to be given at that time. So this little attachment piece here can stay on the skin for 2 to 3 days and then needs to be changed regularly. On the insulin pump screen, it also gives lots of other information. One of the important things that we need to be aware of at camp is the active insulin, which tells us how much insulin is still left over in the body from the previous bolus that was given. So that's something that you guys will be learning how to find on the pump screen. And we will all be working together, no matter what your role is at camp, to make sure that all of these things are monitored and managed appropriately so that our campers can be safe and healthy and have a wonderful time at camp. And now we're going to move on to the complications of diabetes. So the complications occur when the blood glucose level gets too high or too low, and that can cause some immediate problems, which are the things that we have to deal with at camp, and we'll talk about those here in a moment. But also over the long term, so over a lifetime of managing diabetes, if you've had extremely high or low blood sugars throughout, it can end up causing damage to different organs in the body, like the eyes, the kidneys, and the arms and the legs. So we're just going to talk about the short-term things that we'll actually be dealing with at camp right now. So the first one is hypoglycemia, or a low blood sugar. These can be caused by having too much insulin injected, if you've eaten too little food, or if you're exercising more than planned. So there's some pictures here that show the symptoms, and these are the things that we're going to be looking for to help us identify if our campers' blood sugar levels have dropped too low. So the symptoms include shaking, sweating, feeling hungry, being pale or having clammy skin, feeling confused or disoriented. Sometimes kids will complain of headache or dizziness. There can also be sudden mood or behavior changes, like crying for no obvious reason. And as the blood sugar gets lower and lower, kids will start to have clumsy or jerky movements, possibly a tingling sensation around their mouth, and ultimately they can actually have a seizure if it gets way too low. So the way that we address this at camp is that if you see a child who's having symptoms of hypoglycemia, or if they tell you that they feel like their blood sugar is low, then we're going to implement the 15-15 rule. The basics of this means that you would give the child 15 grams of carbohydrates to eat or drink, and then we make them rest and relax for 15 minutes. Then we recheck their blood glucose level and repeat the 15-15 rule if it's necessary. So our full protocol for how to work through this is here. So we're going to talk through it just so you guys know what to expect. So obviously the first step is to check the blood glucose level. If the camper is using a pump, you'll also want to check that pump screen for active insulin and call a provider if there's more than one unit still active. You'll have a list of phone numbers to call on a daily basis to make sure that you have somebody you can get a hold of who can help you with this if necessary. So when you have the blood glucose level, if it's less than 60, that's also a time where you'll need to call a provider, just in case the blood glucose keeps dropping lower. We want somebody to know that's going on so they can come and help if they need to. And certainly go ahead and treat with that 15-15 rule. If the blood glucose is less than 70, you don't have to call anyone. You can just do the 15-15 rule. If their blood glucose level is between 71 and 100 and they have symptoms of hypoglycemia, then we want to use the 15-15 rule, like we've already discussed. But if the blood glucose level is between 71 and 100, but they don't have any symptoms. So this can sometimes come up if a child just randomly wants to check their blood glucose level, or if the rest of their cabin group is checking and they decide to check too. So they don't have any symptoms, but we just happen to be getting a number. If it ends up being between 71 and 100, you want to give them 15 grams of carbohydrates, but they don't need to wait 15 minutes and they don't need to be rechecked. For all of the kids, though, we want them to have a blood glucose level over 70 and be feeling well with no symptoms before they go back to their activities. And then if you're doing this, checking blood glucose levels and treating lows while the kids are out doing their activities, they'll be recorded in a blood glucose field log. So this is just an example of what that will kind of look like, that you guys know how this will go. Obviously, the log will have the child's name on it, and you'll want to record the time at which you check the blood glucose level, what the blood glucose level was, how many carbohydrates were given, and any notes about that specific situation. And then 15 minutes later, you would record the same information again, and that can continue throughout the day as blood glucose levels are being checked. However, if the blood glucose level is very low, or if it won't come up and it keeps dropping, we can end up in a situation where kids have severe hypoglycemia. So this is when they're unable to eat or drink, so there's not really an easy way to get carbohydrates into them. Certainly if they're unconscious or if they're having a seizure, it becomes very challenging. So if either of these situations are going on, you'll want to call a provider right away, and if there's not one that you can reach easily, then go ahead and call 911. But ultimately, you're going to want to lay the camper down and have them on their side. And then we want to administer glucose in whatever way that you can. If you're the first one there with the camper, your go-to treatment is going to be to use glucose gel, which is basically like a little tube of frosting that you can squirt into the mouth and rub into the inside of the cheek or into the gums to have a way for some glucose to get fairly quickly absorbed into the system. But if you have called a provider and if somebody's coming to help, they will be bringing with them a medication called glucagon. So glucagon is a natural hormone which causes glucose that is stored in the liver to be released into the bloodstream. It's a medication that is injected into the thigh, and it comes in a little kit like this. This has a vial that has the medication in powder form, and then a syringe that has fluid in it. And then there are instructions here that show you how to prepare it so that it's ready to be used. However, it's very, very rare that we actually have kids go into a seizure or actually need glucagon at camp. And if that were to happen, it would only be a trained staff member who would be giving glucagon. So if you have never given injections before, you don't need to worry about learning to start now. This will only be done by somebody who's done it before. And like I said, it's very, very unlikely that it would need to be done at all. The next thing that we'll talk about is the opposite of a low blood sugar, which is hyperglycemia or a high blood glucose level. So this can occur if the body gets too little insulin, if you end up having more food than anticipated, or less exercise. It can also happen if the body is under stress. This can be from an illness like a cold or a sore throat, or just any general stress that the body might be experiencing. So the symptoms to be looking for a high blood sugar include excessive thirst, increased urination and trips to the bathroom, feeling tired or weak, and blurry vision is another thing that kids might complain about. So if the blood glucose level gets really, really, really high, we can end up having an issue where there are ketones present in the body. So when there's not enough insulin to make use of the glucose that's available in the bloodstream, the body starts to break down fat to use for energy instead. And the use of fat creates ketones, which are acids, and can build up in the bloodstream and cause a condition called diabetic ketoacidosis, or DKA. Now, DKA is a medical emergency, so any camper who got that ill would need to go to the hospital. So we really want to prevent high blood sugars from getting out of control so that we can prevent that from happening. It takes a long time for enough ketones to build up to cause DKA, so it's very, very rare to see this at camp, but it's important to be aware that that can happen. So the way that we're going to address this at camp is that if a camper's blood sugar is higher than 300 and there's no good explanation for why it's that high, or if they're sick, then we're going to check if there's any ketones in their blood. If there are, then they'll need to have water available to drink, and then a provider will need to be contacted to figure out the best way to flush those ketones out of the body and get the blood glucose level under control. So those are the basics of diabetes. If you have any questions, please bring them to your training session, or feel free to contact your ADA representative. We look forward to seeing you soon.